Hello, I'm Dr. Bohn, a chiropractor at Accidental Health Chiropractic, Physical Therapy and Massage in LaVale, Maryland. When someone says that they have sciatica or sciatic nerve pain, they're usually referring to some form of irritation to their sciatic nerve. The sciatic nerves are the largest nerves in the body, and you have one both in the left leg and in the right leg. These nerves start in the lower back and they run down through the hips, through the buttocks, and into the legs, all the way down to the feet. People suffering from sciatica often have pain or discomfort down the back of their legs, even though the cause of the pain originates in the lower back or even in the pelvis. The 5 most common causes of sciatica, at least as I've seen it, because there are many different causes and reasons someone could have sciatica, so I'm only going to talk about the 5 most common. Number 1, a person has had some type of injury, something like a slip and fall, and this can occur when an unusual or sudden, unexpected motion causes injury to the spinal bones or the discs. This could be something like stepping into a hole when you're walking that you didn't see, missing a step, or even a sudden, unexpected strong sneeze. Number 2, repetitive wear and tear. This is usually due to a job that requires the same motion over and over a period of years, causing degenerative changes to the spine, causing the nerve openings to narrow and pinch or compress the nerves. Number 3, pressure on the nerves from a tight muscle like the piriformis muscle that's located in the buttocks. It's near the top of the hip joint. Piriformis syndrome is an uncommon condition and can be difficult to diagnose. It can usually be treated with some rest and chiropractic or physical therapy, and you'll see good outcomes. Number 4, spondylolisthesis. This condition occurs when one vertebra slips forward on another, causing spinal instability that closes the gap through which the nerve passes. The resulting compression or pinching of the spinal nerve produces the leg pain that we commonly call sciatica. Number 5, pressure on a nerve from a disc bulge in the lower lumbar spine, sometimes called a slip disc. Now, this is one of the most common causes of sciatic nerve pain, and it's also the cause of the pain on most of the patients that we treat with sciatica. It's important to know that a prolapsed disc, a herniated disc, or even a slip disc, as some people will call it, is not simply a disc that has slipped out of place. It's a little bit more than that. The intervertebral discs are filled with a gelatinous substance in the middle called the Nucleus Propulsive. And when a disc prolapses, this jelly-like center squeezes out and puts pressure onto the spinal cord, compressing the nerve roots and causing pain. Now, depending on where the sciatic nerve is pinched, determines where the pain radiates and where it's felt. The L5-S1 disc at the very base of the spine is the disc level most commonly damaged from a prolapse. Chiropractic treatment of sciatica. Musculoskeletal injuries like sciatica are the most common problems that chiropractors treat on a daily basis. And the treatment for sciatica varies from patient to patient based on how the injury happened and how well the patient is responding to treatment or therapy. Now, before your chiropractor can build a successful treatment plan, they will review your medical history and conduct a basic physical exam. Generally, chiropractors will address sciatica by taking pressure off of the sciatic nerve and restoring normal motion in their patient's low back, pelvis, and hips. And this can be done by providing the patient with a chiropractic adjustment, spinal decompression therapy, and potentially some soft tissue muscle release techniques and some physical therapy to the affected areas. Chiropractors may look for signs of improvement, things like reported reductions in pain, a centralization of the shooting pain or the referred pain, meaning that pain down the leg is moving upwards towards the back, improvements with range of motion, and also improvements with the patient's daily living, things like putting on their socks without pain, being able to take a walk around their neighborhood without pain, get in and out of the car without pain, etc. Now, how do you prevent sciatica? The key is to keep your body moving properly, and this can be done in a number of ways. So here are a few tips that I recommend to my own patients, and they can be used for preventing lower back pain in general. So the first thing is to try to maintain or build your core stability. Performing regular exercises to promote core stability can help prevent back pain. And I encourage my own patients to stick with an exercise routine for the long term. You'll get benefits for a long time. While you don't have to consult with your chiropractor before exercising, I would recommend it, especially if you have a history of back pain. Now, when my patients consult with me, I try to make recommendations for exercises that will work best with their medical history and their overall health goals. Number 2, stretching. Stretching helps you maintain flexibility throughout your lower back, pelvis, throughout your legs, and it also can relieve pressure that may be building on the spinal nerves. Now, to help with sciatica, you should specifically stretch your piriformis, that muscle at the top of your hip joints, and in the buttocks on both sides. If you find it difficult to stretch the muscles in your lower back or in your lower extremities, try using a foam roller. You can get one at Walmart. Number 3, chiropractic maintenance. Visiting your chiropractor periodically throughout the year can help prevent musculoskeletal issues. I want you to think of it like this, like going in to get a checkup to make sure everything is working and moving as it should. It's very important to maintain spinal mobility. Now, if you still have questions, I invite you to call us at 301-777-3710. Schedule a consultation. We'll discuss your problem in detail to find out if we may be able to help you end your sciatic pain for good.